So in this section, I'm going to talk to you about how to keep somebody that you care for safe. SAFE we're using as an acronym, so each letter of the word SAFE I'm going to break down and talk about in turn. So S is for seating. Before the person you're going to help feed, or before they feed themselves, look at how they're seated. Are they upright and are they in the midline? If they're slumped over to the right or the left, if they haven't got their feet stable on the floor or the foot plates of their wheelchair, they're likely to be more unstable and less likely to swallow safely. In fact, you need your feet bearing onto something in order to produce the basis for the swallow. And sometimes I see people with their feet dangling. That's not a good seating position. So are their feet and legs supported? Is their torso as upright as possible? I know it's not always possible. And their head, is it in the midline? If it's dropped too far forward or if they're slumped forward, they're less likely to achieve a good complete swallow. Should their head need any special support, some of our learning disabled clients might need their head supported just for the eating process, and this can be done with headrests or a pillow to support them around the headrest. Do they need a special chair? Some of our clients have a special chair in the dining room where they're strapped in and supported around their torso if they have difficulty sitting upright for any length of time. So now, within keeping your client safe, we come to A for assistance. How much assistance do they need? I'm sure you'll agree with me that we want the people we care for to be as independent as possible in eating, drinking, but we must keep their swallow as safe as we can. We must avoid the risk of them eating really quickly, for example, rushing, cramming, and then having too much in their mouth for safe swallow. Do they need specialised equipment? We can work with our occupational therapy colleagues to get plate sides and adaptive cutlery. Do they need prompts to slow down when they're eating too fast? And do they just need verbal encouragement to remind them to chew, to eat a little more slowly perhaps, or to go on to the next course? Because certainly when we're working with elderly patients, they may not feel hungry and they may not feel motivated towards the food. So we need to just prompt and assist them in that. Finally, have we helped them get ready for food? Have we talked to them about what's happening in the kitchen and the food that's available? Have we shown them a picture of what's on offer today? And if necessary, if they suffer from poor dentition, have we helped with oral care, maybe brushing their teeth before a meal? That can stimulate and freshen up the mouth and stimulate the taste buds, and tell them that something's coming that's going to be nice for them. So within the word safe, we're now on F, food modification. I'm sure if you're working with adults with learning disability or elderly, frail adults, you'll already know that several of them may not be able to eat the foods that you and I snack on daily as part of our routine meals or snacks. Some very hard foods, for example, are too much for their dentition as it stands now, or if their dentures are loose. We've got to think about what texture is safest for that person, and that's part of the speech therapist's role, and they can work with you to find what motivates the client to eat and what the best texture for them is, and produce a care plan for what foods are best for them. So we think about the texture of the food. There are 5 different textures that we can look at modifying, which we'll go into with you when we talk to you individually about the person you're caring for. And then with the swallow on drinks, drinks travel much quicker in the mouth, and if the person isn't controlling the drink well, we can offer thickening, and so we can thicken the drink to stage 1, 2 or 3, so it's slightly more syrupy, or that it's custard thick, it flows even slower in the mouth, or we can even feed fluids off a spoon if that's safer for your individual patient or client. And finally, within SAFE, we come to E. E for equipment. I've already talked about working together with our physio and OT colleagues, to make the patient as comfortable as possible within their chair. They might need an adaptive chair or a strap to help keep them upright, or head support, and then they may need specialised feeding equipment. As far as SLT is concerned, once we've referred them to occupational therapy to help them get a weighted plate or a weighted cup or some adaptive cutlery with thickened handles that are easier for them to control, we'll also look at whether they need special beakers. So we have a range of what we call dysphagia cups. Dysphagia just literally means problems with the swallow. And we can have cups with spouts, we can have soft flow cups where the holes in the top are only allow a little out at a time. We can have VariFlow cups. We can have specialised straws, although we don't tend to recommend straws, only in certain circumstances. So we'll work with you again on that equipment to make sure it's most suitable to keep the person you care for as independent and safe in their eating and drinking as possible.